If you've been dealing with chronic lower back pain and feel like you're running out of options, this may give you some clarity. Over the last several years, major reviews in journals like the British Medical Journal, Spine, World Neurosurgery has shown that many traditional approaches to chronic lower back pain, including injections and even surgery, often do not provide any reliable long-term relief. Studies have reported that 10% to 74% of back surgeries are considered unsuccessful, depending on the procedure and the patient population. Another study from 2017 in World Neurosurgery found that 1 out of every 5 patients over the age of just 65 was readmitted to the hospital after spinal surgery due to complications. Another large study published in Spine reported that 20% of spinal surgery patients were hospitalized again within just 30 days, most often from infections or uncontrolled pain. And over a quarter ultimately require another operation. What this tells us is very important. Chronic pain or lower back pain is rarely solved by one single procedure. Surgery may reduce pressure on a nerve, but it doesn't correct the movement patterns, the stability issues, or even mechanical stresses that go on the spine that cause the problem to begin with. That's why many patients continue to struggle even after aggressive surgery treatments. The research consistently shows that a better long-term outcome comes from active rehabilitation, progressive strengthening, manual therapy used strategically, and structured programs that restore how the spine functions. This is where high-quality corrective chiropractic care becomes essentially important. Not all chiropractic care is the same. There is a major difference between short-term, symptomatic-based care and structural biomechanical correction. Chiropractors trained in chiropractic biophysics and other evidence-based structure approaches focus on restoring proper spinal alignment, improve posture and load distributions, correct abnormal movement patterns, and rebuild the spine's ability to tolerate the daily stresses. The goal is not just to reduce pain, but is to change the mechanics that create the pain in the first place. For many people with chronic back pain, this type of corrective function-focused care, combined with appropriate rehab, offers a meaningful alternative to procedures like injections and long-term medication use. If you've been frustrated with recurring back pain or feel like you're stuck in a cycle of short-term relief, I hope this helps you understand why that happens and what more effective evidence-based options actually look like.